Gregg Guilfoyle. I'm a plastic, reconstructive, and cosmetic surgeon. I'm seeing patients at both the Bethlehem and the Allentown campuses here at Coordinated Health. The reason I chose plastic and reconstructive surgery is multiple levels. First, innate in me was when my mother was diagnosed with breast cancer. I saw her go through the pain of breast cancer surgery as well as her reconstructive stages and the stress that brought on both my family and my mother herself. Second, I feel like plastic surgery is really the last true general surgical specialty. No one else operates on the face and then the scalp and then the hand and then the body on any given day. Ever since I was a little kid, I wanted to go into medicine. Probably the hardest decision for me was giving up athletics for better grades. I was born and raised in Boston and went to undergraduate at the University of Vermont in Burlington, Vermont. Since then, I went subsequently to medical school in Maine. I tried to stay in New England to be closer to my family. After medical school, I relocated down to Philadelphia for my general surgical training. I did 5 years in the mainline health system just outside of Philadelphia. Having met my wife down in Philadelphia, I tried to stay local for my fellowship, and I did my 2-year plastic surgery fellowship at Temple University in Philadelphia. There's 3 kind of stages to plastic, reconstructive, and cosmetic surgery. I mean, there's very different aspects depending on the patient population that we're seeing. There's the patients that I treat primarily, which tend to be a lot of skin cancers and that sort of thing. Then there's the people that have been operated on by other doctors that need my help in their reconstruction. The most common in that scenario, I would say, is the breast cancer patient. And on top of that, there's the cosmetic surgery practice, which is a completely separate niche. And in that respect, the patients that come in are basically providing a service for what they feel that they need help with. As far as all the different procedures that I perform, I have my favorites in each different area. I would say in the reconstructive side of things, my heart and soul goes to the breast cancer patient, as my own history of my mother. As far as the skin cancer patients, they're probably the most thankful patients on the planet when they have a lesion on their face and say, I need to get put back together again. And then once it's over, they're the most grateful patients on the planet. As far as the cosmetic surgery procedures, probably the most common procedure done in the United States right now by any surgeon is Botox. Millions and millions of procedures are performed every single year. As a plastic surgeon, we talk about patients' wellness and health and well-being in a different way than other doctors do. The most common thing I would tell people is stop smoking. Nothing ages a patient's face like cigarette smoke does. Second, moisturize. Moisturized skin will always stay healthier, but across the board, the most common reason why patients appear to age more rapidly is sun damage. So probably the most important thing that anyone can do for themselves is protect themselves with sunscreen. In evaluating patients for cosmetic surgery, people do say that they want the nose of Jennifer Aniston or they want the breasts of Angelina Jolie, but sometimes it's not necessarily the most realistic option. It's not a Mr. Potato Head. You don't cut and paste and take the best features of everyone and put them together, because if you did that for some of the prettiest people in the world, it's not going to look right. So it's more what's best for the patient and their physical features. I'm my hardest critique, and I settle for nothing but perfection. So to take that strive for excellence, to bring it to medicine, I feel the same way. Well, outside of medicine, I found the Lehigh Valley very attractive. My wife and I are both active outdoor enthusiasts. We're both adventure racers. Mountain biking, cycling, running, climbing. We love doing all of that sort of thing. And we do it together. We do it as a team. And the Lehigh Valley offers that in every aspect, from South Mountain to Jim Thorpe. Well, one of the most important things in medicine today is continuity of care and the ability for doctors to communicate openly and honestly. I've actually had the pleasure of marrying one of those doctors, and her name is Dr. Gregg Guilfoyle. She's a breast surgeon here at Coordinated Health. When a patient sees and is evaluated by a breast surgeon, the patient would then be sent to my office. We will talk about all the different reconstructive options, what we can offer, what is best indicated for her, what her goals are. Typically I'm involved prior to the procedure itself. Well, I'll be making my markings on the patient where I think that the incisions will be best hidden, where she'll get the best cosmetic result. The breast surgeon will use my markings to do the surgery that they need at their oncological part of their surgery. And then I'm typically there the whole time. It's important to get it done right. So having that open line of communication is 100% necessary. Well, I truly love my specialty in that the day is never the same. Patients have quoted their breast cancer surgeons as curing their cancer, and the plastic surgeons as making them feel whole again. And that's very satisfying to me in what I do every day.